One. Hello, everybody. This is Dr. Dan Cordalicchio. Welcome to the Suburban Wellness Group podcast. I want to get right into this podcast because it is going to be interesting. We have Dr. Elyse Tursi with us, and we're going to be talking about viruses. Dr. Tursi, welcome to the podcast. How are you today?
I'm great. I'm so excited to be here. I can't wait to talk about this really important, hot topic that we've discussed.
Yeah, this is going to be great. So let me just read off a little bit about Dr. Tursi. She's an advocate of all things holistic health and wellness related. She uses functional medicine and its philosophy of root cause healing. Dr. Tursi supports her patients through understanding of the body that is highly integrative. Often patients seek out care for Dr. Tursi when they have chronic digestive problems, colitis, constipation, SIBO, Crohn's, thyroid functions, hormone imbalance, post-birth control syndrome. We're going to talk about that too. And heavy viral load, just to name a few. Specializes in enzyme replacement therapy. She's practicing in Long Island, New York. We actually, my wife and I actually lived on Long Island for a number of years. I had an office in Ronkonkoma, and we lived in Huntington for a period of time. And then we bought a house in Northport. And I'm a New Jersey boy, so we decided to come back to New Jersey.
Yeah, I'm sure. Long Island's beautiful. I love the area. Huntington is a gorgeous area, but it's very congested. And even this morning, getting up and kind of going out now that we're getting out of the virus, it's back to Long Island traffic. I was like, today is the first official day that we're back to Long Island traffic.
And for those of you who are not familiar with the tri-state area, the traffic is intense, to say the least. When we lived in, Dr. Tursi, when we lived in Northport, traveling 25A on a Saturday morning, it was interesting. That half mile that you had to ride sometimes would take an hour. And I grew up in northern New Jersey, which is probably the most densely populated place on the planet, and it was the same way. Wow. So let's get into the podcast. Let's talk about viral load. What does that mean? And how does that affect our health?
Yeah, so I think this topic that we're going to discuss, it's a little bit underrated in the sense that people aren't familiar with the concept of viral load. They sometimes say, Dr. Tursi, you're bringing up viruses. Why does that have anything to do with my health? Like, what is the deal with viruses in my immune system? So the viruses that we are exposed to, whether we know about them or not, actually can come into our cells and change the way we're processing things. They can change our genetic expression. And they basically can change or set off genes that can create autoimmune conditions. And so oftentimes in my practice, what I usually am testing for is triple-digit viral load. So for example, people might come in, they might say, I'm tired all the time, I feel achy. We do a full workup trying to really identify what might be the cause. And then of course, some comprehensive blood work. And sure enough, we see all of these triple-digit viruses that are cropping up in their health. And so when I say that term viral load, it's really just looking at some of the viruses that we do know about and some of the viruses that we can test for in their blood work, and also some of the viruses that we don't know anything about. So I know right now, with the pandemic and the coronavirus, a lot of my patients, some of them have said to me that they think that they had the coronavirus back like way before we even knew about it. They were like, I definitely had this. Some of the symptoms that I'm now learning about, I had that before it was an actual thing. And so the concept is that we are bombarded and exposed to so many different viruses that we do know and don't know, and they can create dysfunction or they can create symptoms. And so really that's what it's about. It's about looking at how is the body responding to some of the viruses that we're exposed to.
That is fascinating to me. So let's back up here. What are some of the viruses that can create these havoc on our body? And for those of you, I'm taking notes already. Mm-hmm. So, pull out your pen and paper and start learning from Dr. Tursi. What are some of these viruses?
The main virus that I see in clinical practice more connected with Hashimoto's Thyroiditis is Epstein-Barr. So EBV is in the herpes family. It's herpes simplex 6. And the nature of this virus, we all know it. Like most of us have said, wait, I must have had EBV. They're familiar with that because they've had mono. They know that that's the virus that causes mono. So typically we get mono in our adolescent life, maybe age 18 to 25, 26. And anybody that's had mono, I would say probably 8 out of 10 of them, they feel entirely different. They're like, I remember when I had mono, I was never the same. I was exhausted all the time. My sleep requirements went up. My energy levels just weren't there. And so the virus, there's many of them, but Epstein-Barr in particular is a very kind of common virus. And it's a known thing. This is not like voodoo. You know, this is sometimes with functional medicine, we're kind of pushing the brink of how we think about things and new coming science, but this is in the literature. If you go on PubMed, if you go on the National Institute of Health, if you go on the research-based stuff, it's in the literature that viral load, especially Epstein-Barr virus, is connected to lupus, SLE, systemic lupus erythematosus, and also Hashimoto's thyroiditis, which is an autoimmune thyroid condition.
And you know what? It is true, because in preparing for our podcast, I went on and I was looking at some of the literature, and I found this fascinating. So let's talk about Hashimoto's. It's an autoimmune condition, autoimmune thyroiditis. How does an Epstein-Barr viral load lead to a Hashimoto's type of a situation?
That's a really great question. And that's actually that's one of the things when I'm explaining this to patients, they're a little bit confused, like, but how does this affect my thyroid? Like, what's the connection in that? And really what's happening is that when we pick up a virus, the nature of the virus can affect different tissue types. And Epstein-Barr actually infiltrates the thyroid gland. So for whatever reason, when we get the virus, it loves to seed the thyroid. That's what it's called. It's called seeding the thyroid gland. And what ends up happening is that our body, as a protective mechanism, says, wait a second, I see that there's this virus in the gland. We need to go there. We need to mount an immune response. We need to put those lymphocytes into that tissue. And then what happens is, because the virus lives in that gland, the immune system starts to attack the gland, trying to get rid of the virus through what's called molecular mimicry. And so it's basically, I wouldn't say it's an uh-oh or like oops, how did that happen? It's an intentional thing, but it leads to tissue damage. And so what happens via molecular mimicry is that now we've created the perfect conditions for T lymphocytes, which are part of our immune system that helps with viral load. They start to infiltrate the gland, and then it leads to DNA replication. It leads to activating something called eVNA2. It's part of the viral coding process, and the virus comes in and it turns on genes. It turns on genes that have been quiet or should be off. So really, through genetic expression, through viral replication, the nature of the virus can affect the thyroid. That's just what it does. It goes to the thyroid. Why doesn't it go to the pancreas? Why doesn't it go to the spleen? I don't know why, but that's just the nature of how it kind of comes into the body, and how our body says, what the heck is this?
Right. So let's step back a few. So Epstein-Barr virus, what makes us susceptible to the Epstein-Barr virus?
Just living, just being a human. So being a human, you are a carrier of the virus. It's extremely common. And I would say, because I'm ordering extensive blood work with my patients, I would say that 9 out of 10 people that come into the office, they don't know that they've been exposed. They're not sure at all. And then when we look in their blood work, we find that they have triple-digit viral load. And what that means is that there is a normal amount in the bloodstream. So if you think you might have viral load, which we'll talk about, how do we know, like, what might be some symptoms? But there are ways for us to go to the blood chemistry and to say that, yes, you've been exposed. No, this is not a new infection. This is something old. And your body has memory. It remembers when you've been exposed to viral load. What happens, though, the nature of any virus, whether it's herpes, simplex 1, 2, 3, 4, 5, there's many different classifications, is that it can go dormant. So for cold sores, for example, a lot of us get cold sores. I get cold sores. It's herpes simplex 1. The cold sore virus lives in the spinal cord. So what happens is that when we get flared up, or when we get stressed out, or when we're exposed to ultraviolet, it comes out of what's called the dorsal root ganglion, and it travels through a specific nerve and into the distribution in the eye, the nose, the mouth. The point of the story, you don't have to know this, it's not a quiz, but the virus gets activated. It's always present and it comes out. And then once you shed, you go through the process, it goes away. Is it gone? Is it out of the body? No, it's not gone. It's dormant. And so that same concept can hold true for any virus, whether it's CMV, which is cytomegalovirus, EBV, which is Epstein-Barr virus, any of the herpes viruses. They are dormant, and then upon the right trigger, whether that be sunlight, whether that be I'm not sleeping, whether that be I'm very stressed out, then boom, they like to kick us when we're down. So we're all really candidates to answer your question more directly. Who gets it? Mostly all of us. Just human hosts are the main.
Right. We're all susceptible to that. And Dr. Tursi, just to let you know that I do send out a quiz to all of our listeners at the end. So hopefully they're going to be studying this.
Sorry guys, we do get a quiz.
we do send the quiz out. So
I love that.
Please, make sure. Well, you know what? We're educating, we're motivating, we're inspiring people. So we want them to learn.
I love that.
Yeah. So tell me, what is the viral load? You were talking about the symptoms of a viral load. Tell me, what are those symptoms?
The number one symptom, well, there's many to be honest, but the number one symptom that I hear is the chronic fatigue. And especially with Epstein-Barr, it steals ATP. So it's literally stealing our mitochondrial energy. And so that's what a lot of my patients, and even for those who knew that they had it, I had mono. I remember having it in school, and I actually almost didn't graduate. I was in high school at the time. I missed 3 months of school. And of course, the way it presents like strep throat. You might say, I have a little bit of a sore throat. I'm a little bit scratchy. You might go to like a minute clinic or even to a doctor. They'll swab. They can test for it. And the timing of it matters, because what can happen is it might yield a wrong result. It might not be present yet. The timing, the life cycle of the virus has to be kind of thought about too. Typically, people will go in and get tested, and then it comes back as a false result, and then the doctor calls back and says, wait a second, come back in, let's do it again. So chronic fatigue is the number one thing that I see, that people are coming to me on their intake form saying, I'm exhausted, and no matter how much I'm sleeping, I'm not feeling recovered. I'm getting 9 hours of sleep, I'm getting 8 hours, I wake up and I'm exhausted. And they can fall asleep. A lot of times they're like, I can fall asleep anywhere. It's an energy virus. A lot of these viruses are energetically taxing our energy that we naturally produce. So of course, chronic fatigue, joint pain, a lot of joint pain. So joint pain is another big one, because the viruses are systemic. While yes, they like to go to specific tissue, they do move through the bloodstream. They travel through the bloodstream. They don't just stay in the region. They don't just stay in the thyroid. They're actually traveling through the body, and all of the immunoglobulins, in particular the IgGs, they're moving around. And so joint pain can happen. Sometimes night sweats. A lot of viruses, what can happen is the patients might be saying, I'm getting a lot of sweats. I'm having night sweats and I don't know why. They've ruled out some scary things. They maybe gone to their primary care and have, investigated what that is. Headaches is another common one. Headaches, joint pain, low energy level, sometimes too heart palpitation. That can happen as well with the nature of, especially Epstein-Barr virus. Trying to think what are the more other common ones. And then of course, autoimmune conditions. Whenever I know that someone's coming to me and they say, I have Hashimoto's, I'm looking for viral load, and it's always there. 10 out of 10 times it's there.
That is very interesting. I'm going to start looking for this in my own practice. I mean, that is fabulous information. Now, you're talking about blood work and IgG. What blood work do you order to determine what's going on?
So typically, the way I've set up my scripts is I have an infection panel on my script. So I've got some basic stuff. I've got my celiac profile, tissue transglutaminase, IgAs. I have many profiles, vitamin and mineral profiles, the basic stuff, the B1, the B2, the B5, B6. And then I have an infection profile. And the infection profile, you can obviously order that and get that through any of the labs, whether that be through Quest Diagnostics, LabCorp. I don't know who you guys have in your area, but Quest is a pretty big lab, and we order panels. So typically, if it's an Epstein-Barr profile, you can order an EBV panel, and you're going to get 4 different markers that will come back to you for you to identify where are we? Are we in the early stages? Are we in that kind of 2-week prodrome period? Are we in a recurrent reactivation place? Are we latent? Where are we with viral loads? So there are some really good blood testing. I'm not the kind of provider that I'm so sold on just because we don't see it in your blood work doesn't mean it's there. Oftentimes I care about symptoms. I care about getting, patients to feel better. Blood work, it's a tool, and it's a tool that we use to support healing, but it's alarming how you can start to see trends in people and you're like, but wait, this is so connected. This is so intimately correlated. And so that's really something that I kind of evolved through this. I always knew some of this stuff, like learning this in, functional medicine. But when I started to clinically practice about 5 years now, I've been doing this. I said, there's connection here. There's so much connection here that I'm just seeing, so frequently. And some of the symptomatology is just there. So blood work is a great place if someone's out there thinking I might have this. I haven't really found what I'm looking for through conventional medicine. I'm not feeling better with some of the recommendations. Where do I go? Get, connected with a functional medicine provider, go through some serious blood work, look at the viral loads, look at the infection titers. And of course, there's lots of remedies out there to support them. You're never going to get rid of them. But there again, it's like the cold sore example that, you can get activation of them and then you have the symptoms.
Right. Yeah, it's important to look at symptoms. It's important to look at the blood work. We use Quest and LabCorp. And then there's another lab, Vibrant America, that is also very good that we use. They're actually in the process of getting into New York as we are talking right now. Now, I want to change directions. We're going to get into the treatment program a little bit later on. But one of the interesting aspects of this, and I was reading some studies, Epstein-Barr and the measles virus, right, leads to multiple sclerosis, MS. And it's been found, and it's been in the brains of MS patients, EBV. Comment on that. I find that so interesting. I'm a functional neurologist, and this is opening up a whole new Pandora's box for me. So, what's the connection there?
The connection there, and there are some studies about this, that there's some unknowns to that, of to how the pathophysiology develops or how the actual mechanisms are happening within the cells. But one thing that I have found in the literature and the research is that, remember, these viruses, although they do have affinity for specific tissue, they're systemic. If they're in the blood, they can go to anywhere, so anything that can come into the bloodstream, it's like poison. If I poisoned you, God forbid, you'd feel it instantaneously. And that poison doesn't just say, I'm going to locate myself into this person's elbow. That poison goes through the whole body because the circulatory system is pumping that blood everywhere. And the nature of the virus is it can go through the blood-brain barriers, and it can get into the, different areas of the brain and different areas of other tissue, not just thyroid, not just digestive tissue, not just musculoskeletal stuff, but really the nature of it is it can kind of do what it wants. And the genetics of that are also another thing that I know there's lots of research coming out about this, that the genetics they're trying to figure out, why is that happening? Like, what's happening in the genome of someone that's causing them to be activated or not activated to induce autoimmune conditions, whether that's multiple sclerosis, Hashimoto's, lupus, whatever it might be. So I think it's really just a general way to think about it. It's because the virus is systemic and it's in the bloodstream, it can go anywhere.
Right. I find that fascinating that a sequelae can be MS. And this is going back to what Dr. Tursi was saying, before, as functional medicine practitioners, we are looking for the root cause. It's called looking for the root cause, symptoms and blood work. And what is it and what can we do to help somebody out by finding that root cause? Let's talk about type 1 diabetes. And I have different viruses now, all right? We discussed Epstein-Barr, all right? Now we're looking at cytomegalovirus, mumps, rubella, some of the childhood maladies, coxsackievirus before, type 1 diabetes. What's going on with that?
I think it's a similar mechanism of action, although it might be unknown. It's just that there's the load, and it has affinity to cause tissue damage. And it's interesting. Hi, say hello. We got a cat here.
That's okay. My 6-month-old cockapoo has been scratching on my door. If you didn't hear that, he wants to come in and say hello also. It's all good.
Cat interruption. But so I think to answer your question a little bit more directly is that is true that some of these, any autoimmune condition that you can think of. And now they're saying that, you know, there's more of them coming. They're starting to say that when we look at these conditions, they're more of the autoimmune classification. And so remember, immune, autoimmune, the word immune is in there. When we get a viral load, when we get a parasite infection, when we pick up bacteria, we're bombarded by stuff on us. I know we all can understand that now. You don't need a science degree or a medical degree to understand that. Wait a second, COVID virus, SARS, it's a SARS virus. It's actually changing our tissue and it's causing people to have symptoms. Same thing for all of the viruses that we know about and don't know about. There's so many things we don't know about. So it really is a matter of when these things come into our body, our immune system, whether that's the innate immune system and the adaptive immune system, they're changing. They're changing the way they're looking at the tissue. They're changing the way that the organs, you know, organs have functions. They carry out jobs. The job of, for example, with type 1 diabetes, the pancreas produces insulin. Without that capacity, the person needs insulin. They require that to digest glucose and carbohydrates. And so it's very true. And I've had friends of mine, actually I have two friends I'm thinking of in particular that traveled overseas, got violently sick, came home and developed type 1 diabetes.
Interesting. Very, very interesting. So they were probably exposed to a viral load. You know, when you talk about autoimmune conditions, a lot of, you know, all the time in my office, I'm always looking at their gut. You know, I'm looking at that leaky gut situation. Is there a correlation between the viruses and what we call a leaky gut?
Exactly. Yes, there is. And the reason why is because, like we said, we're bombarded every day by stuff, critters and different things. But the integrity of the digestive system is important because that's the way to get out. We can't live in a bubble. We're always, you know, seeing these things, but how do we protect ourselves? We do that through healing the digestive system because your gut lives, or your digestive system, this lives in the gut. And so, or your immune system lives in the gut. And so what can happen is if you have bad gut flora, if you have acid reflux, if there's chronic bloating, if there's really bad microflora that we're not looking at, that basically allows whatever to come in and to stay in. Your lymphatic system is not activated. Your filtration is not on. It's almost like, my example is if I have a fish tank that's dirty and we shake up that dirty fish tank, well, there'd really be no problem if we have a filter. The gut is the filter that we're bombarded, we're exposed, fine. We can't, you know, hide from these things, but how do we protect ourselves? We do that through gut healing. We do that through making sure the integrity of our digestive system, including the liver is both the digestive and immune organ, are in a good place. So absolutely, gut health is a key component to healing viral loads, or to supporting them, I should say.
So we've discussed multiple sclerosis, type 1 diabetes, Hashimoto's. We've touched upon RA and lupus. Any other conditions from your clinical experience that can come about because of this viral load?
Sometimes what I see happen is skin manifestation. So there are times I see some autoimmune skin diseases. For example, pemphigus. Pemphigus is an autoimmune skin condition. And so there again, any autoimmune condition, we have to be thinking of viral load. Sometimes skin conditions are responses to food. Sometimes they're a histamine intolerance and someone's, you know, they're missing the DAO enzyme. They don't have diamine oxidase to process histamines. But I would say for anybody that's dealing with anything skin related, if it can't come out through your stool, if it can't come out through the urine, some of these things can come out through the skin, and viruses can do that as well. So any type of unknown virus, perioral dermatitis, that rash is so difficult for even dermatologists to support and for them to treat. So sometimes I get a lot of strange conditions that walk in that people say, I've been to XYZ, I've been to all the ologists, I've been to the dermatologist, the cardiologist, the gastroenterologist. I don't know anymore what's going on. I don't want to keep taking the medication. Yes, we cue the digestive health, and we also have to look for these viral loads. I pretty much go down the rabbit hole with some of these things.
You know, and I think it's important what you just said. You know, they've been to all the ologists, and a lot of times the functional medicine practitioner, we're the last line, you know, of defense that they come to. I wish they would come to us initially. I do work with some of the ologists. You know, initially it was difficult And initially it was difficult because they were like, and what are you talking about? But now they understand. So viruses are all over the place. How common are they? What other viruses are there out there that can create some of these situations? We talked about Epstein-Barr. We discussed a little bit about measles. How common are they? I mean, we're bombarded with these every day. And what other viruses are there? Are there any bacteria that can create some of these conditions that we're discussing?
Oh, yeah. In terms of viruses, are there others? I'm sure there are, and you can kind of think of them as classifications or subcategories because viruses change their shape. They're stealth infections, and meaning that they like to hide out, they like to burrow, they know how to use the host's immunity, hijack our cells, and then do things that we shouldn't have them do. It's almost like they stole our stuff and then they came into our house and, you know, they broke in and then they're using our stuff to make themselves dinner. That's kind of the way that we can think about them.
Right.
I would say that there's probably variations or different types of viruses in those categories, in the EBV, in the CMV, in different types of herpes simplex viruses, whatever there might be, coxsackie, whatever's going on. And they change their shape. So there's probably so many different subdivisions of them. Are there bacteria that we have to be mindful of? Absolutely. So for example, we live in a very Lyme endemic area. Long Island, we're in the woods, we're by, you know, areas, even just all of the Northeast, the tri-state area. And so bacteria like Borrelia burgdorferi, which is the bacteria that causes Lyme, Bartonella, Hensley, Babesia microti, these are all bacteria that we have to be mindful of as well that can create autoimmune conditions and can create symptoms for patients.
Right, and it's a good point because we're in a hyperendemic area here in Monmouth County where I live, and Lyme's disease is just so prevalent. So a lot of these viruses, they, you know, as we said, they lie dormant. How do we keep them dormant? What can we do to make sure that they don't become active?
Yes, that's a great question. Everyone's like, okay, wait, I think I have this. Now what do I do for it? How do I be
right? So where do we go from here?
Yeah, there are some really great natural antivirals. So often if I'm working with someone and I believe that they've been exposed to any type of virus, I'm a big proponent of Byron White formulas. Byron White has an entire line of really great formulas. They're only through professionals. You cannot get them as a consumer. You have to go through a provider. They're super powerful, and you could definitely throw someone into a herpes or a detox if you're not careful. So Byron White, I use those in practice. And really it's botanical medicine. It's herbs and it's tincture forms. They use things like, he uses things like thuya, gentian, melissa officinalis, hypericum. Basically, it's all herbal based, and there's so many. He has a formula made for the Epstein-Barr virus. It's called AEBH6. AEBH6. H6 is because it's the herpes virus. EB, Epstein-Barr. H is for the herpes family. So there are many things that we do to support the virus through some of the natural, we call them natural antivirals. They're not going to get rid of the virus. They're going to keep it dormant. They're going to keep the symptoms gone. You can never get rid of a virus once it's there. Also, like you mentioned, really supporting gut health and making sure that the integrity of the digestive system is there, because 90% of your ability to get rid of what you're bombarded with is coming from good gut health. What does that mean? How is my spleen? How is my liver functioning? Do I have a fatty liver? Do I have NAFTL? Am I burping? Am I belching all the time? Am I not processing? So really gut health is crucial. We can't hide out from these things, but supporting through good rest, through good recovery, lymphatic detoxification. So doing things like dry brushing. I love to do dry brushing. I love to sit in the infrared sauna. Tons of research around the infrared sauna and how you can use that to eradicate viruses in particular. And whenever I'm feeling down, I sit in the sauna for about 30 minutes, get a really nice, good sweat. The sweat allows that lymph, which is our waste, to come out. So we really want to be circulating that lymphatic fluid. There are techniques, obviously, as a chiropractor, chiropractic adjustments, really adjusting the nervous system and supporting the person to not be in a place of sympathetic dominance, which is when they're in that fight, flight, freeze mode. You cannot heal in that mode. So mindset work, especially with my patients, you know, if they're coming into me and they're still stuck in that fight flight mode, they're not able to be parasympathetic, which is where healing occurs. And so are there techniques, acupuncture, moxibustion, lymphatic infrared saunas, exercise, movement moves the lymph. So there's so many different techniques. Of course, the antiviral herbs, enzymes. I'm a proponent of enzymes. I use them in my practice.
Tell me, what enzymes would you use if somebody comes in with a viral load?
Depends on the person. So in practice, there are about 150 different bottles that we use. It's a technique system. I'm certified in a special technique system through Loomis Institute. It's an enzyme replacement technique, and it depends on the person. So I have enzymes that are catered for all different organs, and there are enzymes that are made for the lymphatic system. So really, the way that I work with patients, it's based on symptoms, but there's a special examination if they're able to come to the office that I'm able to do with them based on palpation, which is, you know, really trying to find inflammation in the body. And from that, we use enzymes. It's hard to say which kinds. Sometimes heavy dose protease. When I have a cold sore myself, I use an enzyme that's got like tons of protease in it, because protease digests proteins, and these viruses like to live in viral capsids. They're covered in proteins themselves. So protease can eat away at the capsids.
That is very interesting. And I know that my partner is listening to this, Dr. Natasha Fuxina. She's an integrative internal medicine physician. And Dr. Fuxina, you are now not my primary care anymore. I'm going out to Long Island to see Dr. Tursi because yeah, that's just the way it's going to be. And she's like, you know, she's getting mad at me right now. So, you know, I have like 6 pages of notes. Let's go back to the gut, because I'm a big proponent of gut. What's your protocol for a leaky gut? What do you do in your office?
So really looking at a metabolic reset, a digestive reset, and looking at what is it that they're eating? Step 1, what are you putting in? It is important. Step 2 is what's the integrity or the baseline of the patient? Where are they coming from? Do they not have a gallbladder? Are they missing part of their colon? Has that been resected? Really looking at like a full workup to say what's the integrity of their baseline? Where are they right now? And then what are they eating? What types of things? What's their quality of life? And then really it's through enzymes. I give therapeutic dosages of enzymes to support the repair. I'm not a big supplement person. I'm not against that at all, supplementation, but my philosophy and through clinical practice, you are not what you eat, you are what you absorb. And if you don't have the capacity or the integrity to absorb, we have to go there first.
I totally agree with you. You know, I teach at University of Bridgeport in the nutrition program, and a lot of the students come in, Dr. Tursi, and they think that nutrition is supplements. You can't out supplement a bad diet that's creating a low inflammatory process that can lead to a leaky gut. It doesn't make any difference how much vitamin D or whatever is that you're taking. Now somebody has this viral load, and do they get better? Do they get worse when they start treating with you? Is there that up and down? Can you comment on that?
Absolutely. So there is, you know, like we said before, with some of the formulas, especially when you're using natural antiviral herbs, botanicals, you can go into a healing crisis. You can go into a Herxheimer's response. You can definitely feel it. What that means is that we're trying to take things and think of the dirty fish tank example. Imagine the fish tank's been sitting. Fine. It's been sitting. It's got dirt. There's stuff underneath the rocks. Now we're going to shake that up, and we have to make sure the filter is on. So absolutely, sometimes in the process of getting better, not that we're intentionally trying to make you sick, but these stealth infections live in biofilms. They are not going down without a fight. And the fight is what you feel. You get the headaches. Your symptoms might ramp up. You might even feel a little bit more joint pain. You might get a little cranky. You might say, I'm super moody today. Sometimes that's a Herx response. And so it's an intended response. It doesn't mean there's an adverse or a bad response that's happening, but we have to be mindful that that could potentially happen. And it happens usually quickly. It's not like, you know, someone's worried 3 months, 4 months later that, uh-oh, I'm Herxing. Obviously, if you change their formulas, they can, but it's kind of like the expectations of going through a viral load are that you might feel a little bit worse before you feel better. On the flip side, I have patients that call me that are like, remember that thing that you warned me about that didn't happen? Is it working? Yes, it doesn't have to happen. We don't know. It's almost like trying to ask someone, well, if we put 10 people in a room with someone that's sick and they're sneezing, who's going to get sick tomorrow?
Mm-hmm.
We don't know.
Don't know.
Right. It depends on many different factors. So yes, there is the potential of entering into a herpes response or undergoing a healing crisis. It does not last long. Most of the time it's very tolerable, lots of fluids, lots of rest. You just don't want to start maybe a protocol like this on a Sunday night when you've got a big work week coming up.
Right. Is that detox response that you're talking about?
Yes. Yes.
You know, because you've mentioned that several times. So what happens? You know what? I've just been recently diagnosed with thrombocytopenia. I have an autoimmune condition, and can I still help myself even though I'm compromised as an autoimmune, condition? Is it something that we can still work with? Because I think our listeners are saying, okay, you know what happens if I'm already been diagnosed with a RA or lupus, Hashimoto's? Can you still help somebody like that?
Absolutely. There's never a place at which we just give up. There's never a point we just say, oh, we're going to just surrender. Like, I've got this thing. Often autoimmune conditions breed other autoimmune conditions. So if somebody has one, here comes maybe some others. And the reason that happens is because now the immune system is flared up, it's activated, it's on, or maybe it's off, maybe it's too quiet. So depending on the person, but absolutely, even if you're someone that's saying, yes, I know I have a known autoimmune condition, I've been diagnosed by my primary care doctor, what can I do to support myself? Absolutely. Healing the digestive system, absolutely. Looking at your vitamin and mineral profile, doing viral loads. There's so many things that you can do to support yourself proactively.
So you mentioned vitamin and mineral panel several times. Have you noticed, is there a pattern with those that have an autoimmune or a viral load? Are they deficient? Do they have low vitamin D? Is there any different types of deficiencies? There
are. Often vitamin D is low. Now the reference range, they typically say between 30 to 100, depending on the lab that you're using. Mm-hmm. Often I see values that are in the 20s, 25. I've seen as low as 7 units. Vitamin D is involved with about 50,000 metabolic processes. It's not just about, I think we have this thing, vitamin D is just for bone health. That is like a little smidge of what vitamin D does. But we absolutely can find that a lot of these people are coming in with these infections and maybe sometimes co-infections, viral loads, and they are very deficient. They're depleted in certain things. And sometimes it goes the opposite end where there are people that are trying to self-treat or support themselves, and then all of a sudden we look at their blood work and they're harboring everything. They're B1, B2, B6, there's tons of vitamin C, there's overdosing on vitamin A, the CoQ10 levels are high, glutathione levels are through the roof. So that's really where I know someone's trying to do something. Is it the right amount for them? Maybe not if they're storing it in their blood. It might not be being absorbed into the tissue. Right. They might have expensive urine, but there's two spectrums that, yes, there's some deficiencies, and then there's the people that have the deficiencies that are trying to compensate and then we spill over. And now I'm seeing tons of high levels of vitamins. But absolutely, vitamins are not frivolous. It's not, when I was younger, I remember my mom saying, take your gummy, take your vitamin. Right. And we think that it's just something that little kids take, like they need their gummies. No, we definitely need to make sure. And through food, I'm not advocating go out and just take supplements. No. Know your why. Why are you taking this? Is it the right amount? Are they methylated? Sometimes people have genetic variants where they can't use specific vitamins. So, what's the integrity of their body's ability to process things? And absolutely, really making sure that they have enough stuff. But yeah, vitamin deficiencies are something that I do see. Vitamin D for everybody is low, regardless of if they're healthy without an autoimmune condition or they're not. It's usually low 10 out of 10 times.
Yeah, you know what? I don't have many patients coming in and their vitamin D levels are within those normal limits, as we say. And I had 2 patients yesterday, and they were like, "Oh, Dr. Dan, I supplement with vitamin D, and my vitamin D levels are low." And I won't tell you where they're purchasing them from. However, New York State, I think it was about a decade ago, went into various went into various stores that sell vitamins. And, you know, a lot of these are filler. It goes back to what you were saying before. You need quality products, and you want to come to us because we can dispense those nutraceuticals that are good, if you will. You know, we know that there's vitamin D that's highly absorbable, maybe with K1, K2, which is very important. I want to spend a little time on COVID. Have you seen a lot of COVID patients over the last several months?
You know what? I have not. And I've been testing in a lot of my patients in their blood work. I have not seen a single positive SARS-CoV IgG antibody in my office, and I'm looking for it. I have not. I've heard stories of people. I've heard stories of people that have had, you know, the virus, and they had a lot of the symptoms, but I personally have not worked with anyone that's had it. However, I do think that this might be a learning curve, that if someone does have it, I might try to support them with some of the antivirals that may help them, you know, for those people that have this. And we don't know, they're saying about a second wave. Is that true or not? Can the virus mutate? Why is it showing up differently in children? But there's still so much for us to learn. I don't think we know all about it, but I would imagine in the future that people might end up developing a reactivation of some of the symptoms. Maybe a year down the road, they're like, I can't smell anymore and I've lost my sense. Maybe I've reactivated. What do I do with that? There's probably going to be, for anybody that's in the nutraceutical platform, they're probably working on something right now that's going to be maybe supportive as a natural supporter for viral load for the COVID.
Right. I know that a vaccine's being worked on right now, and I was listening to Dr. Aristo Vajjani, if you know who he is. He's a PhD. He's a functional immunologist, and he's one of my mentors. And he was saying that the best vaccination is having a strong host, us, to ward off all of these viruses. And you know, in our office, we didn't have anybody that tested positive, and
I'm looking for it because I'm curious to see, you know, but I've had nothing.
Right. You know, we haven't had anybody. My partner, she's, like I said, she's an integrative MD, and she has another office, and she has seen more of it there, but she's working with them, you know, from the nutraceutical standpoint. And you know what? I think everybody who's listening to this, you know, go see Dr. Tursi and make sure that your immune system is strong, because, you know, viruses and bacterial infections are all around us. And it's very important to make sure that you're very strong. I see that we're coming upon the hour here, and it seems like we just started. And is there anything else you want to tell you know, our listeners out there? Anything that we missed? Anything that you want to communicate?
I don't think so. I think that's enough. I feel like if I start talking about something else, we'll go to another hour. I feel
probably.
But if there's any topics that the listeners want to know about or want to learn more about, I know that we've talked maybe about post-birth control syndrome and hormone balance. I would be happy to talk about that with some of the females that want to know about hormone imbalance, and not just thyroid hormone imbalance, but sex hormone imbalance, like testosterone, DHT, DHEA, all three versions of estrogen. So I would be happy to talk about that, but I won't go down into another topic now because we'll go over time. So
for all of our listeners, I mean, Dr. Tursi, I mean, she's amazing. I mean, she's a wealth of knowledge and information, and we'll do another podcast. I'm going to invite you on again. So that, yeah, we'll have you come on in a month or two, and we'll discuss that. And it's okay if I discuss that. I have some OBGYN docs that have been on our podcast, and we discuss a lot of female issues. So they kind of laugh at me at the end, and they say, oh, you handled yourself pretty well doing that. Well, you know, we're doctors, so we can discuss that, even though I'm a male.
You might be male, but you have a wife, and you care about women. So by default,
of course. Of course. So, you know, my wife is a patient of mine, and you know, we have to make, I think I'm gonna have to send her out to you. You know, actually, she just came back in from Long Island. She went to go see her family, so we could have had a consult and an exam at some point in time.
Absolutely. We'll have to plan something in the future. I would be happy.
Yeah, we'll have to do that. So everybody, I want to thank you for listening. Dr. Tursi, tell me, where can potential patients and where can individuals find you?
They can go to really on all platforms, I'm the same person. So you can go on YouTube, Dr. Elyse Tursi. You can go to drelysetursi.com. That's my website. You can go to Instagram, Dr. Elyse Tursi. I'm just myself on all platforms.
That's great. So, I highly recommend Dr. Tursi. So, give her a call. Wealth of information, helping out people. It's been a privilege, honor and privilege to have you. I have 7-8 pages of notes. I've learned a ton myself, and Monday morning we're going to be adding some of the stuff that you've been talking about. So I'm excited about that. Thank you very much, Dr. Tursi, for being with us.
Thank you so much, Dr. Dan, for having me.
Yes. So everybody, thank you for listening, and follow Dr. Tursi. Give her a call and look for the next podcast for the Suburban Wellness Group. Thank you for listening.